using QI methodology to improve uptake of our Trust's Waiting Well website. The elective reform plan and Getting It Right First Time initiatives have prioritised reduction of late notice cancellations as a key improvement target. On-the-day cancellation rates across all sites at our Trust fluctuate between 8 and 12%. The reasons for this are of course multifactorial, but a significant number may be preventable, and we recognise the need for patients to remain well and optimise their health while waiting for surgery. A survey of patients undergoing elective major surgery at our Hammersmith site demonstrated limited engagement with the Trust Staying Well While You Wait website, with only 3 of 22 patients being aware of the website, despite the majority expressing a desire for additional perioperative information and support. These findings highlighted suboptimal use of existing patient information resources and informed the development of this quality improvement project. We mapped out our project using the A3 model as part of the Model for Improvement endorsed by the Institute of Healthcare Improvement. This allowed us to approach our problem in a stepwise manner using recognised QI methodology. One of the key steps in the A3 model is identifying the factors causing the problem. In our case, what are the barriers to patients accessing or waiting well resources? We did this using a cause and effect or fishbone diagram, which was informed by conversations had with patients during the survey process, as well as conversations with relevant staff. Factors in red are things we recognise we may not be able to impact within the limits of this quality improvement project. Amber are things we may have some influence on or be able to support patients with. And green are things we can definitely change as part of our project. We then moved on to defining our SMART aim and driver diagram, which is a visual display of what drives or contributes to a project achieving its aim. The target of 10% increase in uptake will be measured by total number of views on the website each month over a 6-month period initially. Staff and patients are our primary drivers and the main stakeholder groups we need to engage and motivate. Change ideas are in the right-hand column and will form the basis of our PDSA cycle. We have a number of change ideas and are currently exploring the feasibility of each, a lot of which overlap with a number of other projects going on in our Trust as part of a wider perioperative transformation project. In summary, we have identified a number of barriers to patients accessing existing waiting well resources, and using recognised QI methodology, we have formulated a plan to tackle as many of these barriers as we can across our Trust. We're excited to work with patients and a multidisciplinary team of staff to enact our change ideas in the coming months.